Greetings to all colleagues who are taking a clinical epidemiology course, sorry, offered on Coursera by University of Aldrich. So we are in, beg your pardon. So we are in week three and week three, and this is the second pair graded assignment according to the reference standard. So the article is the same which was given the previous article published in British Medical Journal. The accuracy of clinical symptoms and signs for the diagnosis of serious bacterial infection in young febrile children. So prospective cohort study of 15,781 febrile illnesses. So we are asked that what was the reference standard used in the study. So of course it's the culture test which is used as the reference standard in the study, because in order to diagnose a bacterial infection or even a febrile infection, so we have to do a culture test. So for the culture test, they take sample from blood, urine, and CSF, and given to the microbiology lab to do the culture test. And after 24 hours, usually take 24 hours for the test to appear. So they confirmed and diagnosis that whether it is a urinary infection, whether it's pneumonia, or it's a bacteremia. So reference stand was a culture test, and in such febrile illnesses. So I think the reference stand they use is quite okay. It's good because it's a gold standard. Whether if you have you can say that you want to have a better clinical diagnosis, whether on such cases. So I think culture test is a very good parameter at our disposal. So, but there are some other diagnostic tests, but they don't apply to here. Whether patient may be suffering from malaria or typhoid. So they are just single kit tests. You just take blood and plasma out of it, and within minutes you have the result, whether the person has typhoid, whether the person has malaria or not. So, but in such case, bacterial infection. So culture tests, they are the new. You can say they are the more accurate, sensitive, and specific tools at our disposal. So I think the best part of this was, you can say that there's a pro that it's they are using culture sensitivity as a reference standard. So I'm okay with it. Uh, but what they did next, actually, they prescribe medication, antibiotics, to the patients. To children, usually they are on IV antibiotics. Are more in practice. They usually prescribe IV antibiotics. So, but the culture sensitivity test, they didn't include on that particular thing. Although it's not part of it, but they 16,000 febrile illnesses. So I think they should have. I think the study should include a culture sensitivity test also, because in this way they can have a great sense about what is causing the UTI, and what's causing pneumonia, and what's causing bacteremia. So usually, we have identified organisms, but I think the thing I just found, to be questionable was that culture sensitivity test was not included. Culture sensitivity tests are usually carried out, they test the culture on various antibiotics, and find out on which antibiotic it is more responsive. So I think that's my argument, and well, the reference standard they use is acceptable. Culture test and blood CSF use. So I think my uh, argument concludes here. Thank you.